Hello guys, in this video we are going to see the anatomy of external ear. The external ear is of three parts. The first is the auricle or pinna, and then is the external acoustic meatus, then is the tympanic membrane. First let us see the pinna. This is the pinna or auricle. Okay guys, the parts of the pinna are like helix is the first part, this large helix. Opposite to the helix is the anti-helix part guys. Then there is a tragus guys, and the function of the tragus is the collection of the sound waves into the external acoustic meatus. Opposite to the tragus is the antitragus, and then there is a large part known as concha. This is divided by the crus of the helix into symboconcha, and this is another concha. Okay guys, um, then this entire pinna is developed from yellow elastic cartilage guys. This except lobule which has no cartilage, this entire pinna is developed from the first and second arch guys, from the first and second arch of pharyngeal pouches guys. Okay, then this is another this is known as insusura terminalis along the crest of helix. It is used for the end oral approach. There are three approaches in operating through the pinna guys, operating the ear guys. It's endomeatal approach, it's operating through the meatus, or end oral approach. This is the operating towards incisura terminalis, and there is post oral approach, there is p and the pinna approach is done. Okay guys, this clinical picture, it's in mastectomy. The symboconcha, C guys, symboconcha is the anatomical landmark. Symboconcha is the anatomical landmark for mastoid as ulcer. But when this doing procedure, when this concha is removed, then McEwen's triangle is the surface landmark for mastoid acid. Mastoid acid is the longest, biggest mastoid cell in the antrum guys. See, this is the McEwen's triangle. The boundaries are inferior temporal line and posterior wall of external acoustic meatus. That means it's 2.5 millimeter away from external acoustic meatus is the McEwen's triangle. Then second part is the external acoustic meatus. Its outer 1/3 is a cartilaginous part, and the inner 2/3 is the bony part. This is outer part is 8 millimeter, inner part is 16 millimeter. There are deficiencies or narrowings in both cartilaginous part and bony part. In cartilaginous part there is a deficiency known as fissure of Antonelli, whereas in bony part in children and in the anterior inferior part there will be anteriorly means you can imagine guys, in the anterior inferior downwards there is a fissure known as foramen of Huske. Another is the isthmus will be there, which is 6 millimeter lateral, 6 millimeter lateral to the this is tympanic membrane, lateral to tympanic membrane. This is, it will be here is the isthmus guys. The cartilaginous part secretes contains ceruminous glands which secretes cerumin. Wax will be present in the cartilaginous part. It contains cerumin, other secretions and dead epithelial cells case. Then the last part, very important part, is the tympanic membrane. This tympanic membrane contains many parts like pars tensa, pars flexura. Let's discuss in deeper that. First let's see the layers of tympanic membrane. When you go through the outer meatus, there will be outer epithelial layer continuous with the meatus guys. Then when you come through the middle ear, you can see the inner mucosal layer continuous with the mucosa of middle ear. In between those two layers is the middle fibrous layer, which is the biggest layer guys. Everything is made up of this fibrous layer. It has three types of fibers: circular, radial and parabolic. See, circular fibers, radial fibers radiating outsides, and there will be parabolic fibers guys. Okay, then you need to know about annulus tympanicus. That is, it is formed by the fibrous layer, it attaches tympanic membrane to the meatus or acoustic canal. It encircles the tympanic membrane, but there will be deficient or that this annulus is not present at one part at the head lateral process of malleus. This there will be deficiency. This is known as notch of Revinus. This is covered by a membrane known as Sharpness membrane, or this is known as the pars flacida. Okay guys, then there will be significance of certain parts like umbo. This is the umbo guys, or you can see this is the umbo. Okay, this is the what we can see is the most visible anatomical landmark when you see the tympanic membrane, but it is mobile due to the short process of malleus. So this lateral process of malleus is present here is the most reliable landmark of tympanic membrane while doing surgery and other things. Then based on this umbo, this tympanic membrane is divided into 4 quadrants with 2 planes crossing each other. This is the anterior superior quadrant. See guys, this is the, you can see this is the anterior side, this is posterior side, this is superior, and this is inferior. Anterior superior, posterior superior, anterior inferior, posterior inferior. Okay guys, then we can choose the relations of external acoustic meatus guys. Imagine this guys, as your external aquatic meatus. Anteriorly you have the temporomandibular joint where the mandible and the maxillary joint. Then posteriorly visualize guys, you can see the mastoid arsal and antrum be there, mastoid will be there. Then superiorly think above guys, you can go into middle cranial fossa. When you come down inferiorly, you can see the parotid glands. In the nerve supply of each organ, each parts. Nerve supply of auricular pinna include this entire part like helix, this triangular fold, lobule, everything is anteriorly and posteriorly is supplied by greater auricular nerve C2 C3 guys. Then the inner concha part is supplied by the 7th it is facial part of facial nerve and the 10th vagus nerve guys. And then upper part of certain posterior part is supplied by the lesser occipital nerve, and some part of this helix is supplied by the auriculotemporal nerve, part of this 5th nerve. What is the 5th nerve guys? Imagine this is the trigeminal nerve. Then this if you most common problem of the pinna is the lobule injury or earring injury. So if you need to operate, you need to do C2 C3 block, and then you need to do the lobuloplasty. Then we are going to do the nerve supply of external aquatic meatus. See guys, this is the external aquatic meatus, this is the tympanic membrane. This anterosuperior part is supplied by the auriculotemporal nerve, part of the trigeminal nerve. Then this posterior part is supplied by the division of the facial nerve, and then this anterior part is supplied by the Arnold's nerve, is a branch of vagus nerve guys. Okay, then the last part is the nerve supply of tympanic membrane. The lateral aspect, when you come through the external ear, this part is supplied by the Arnold's nerve, part of 3rd nerve, and auriculotemporal nerve, part of the 5th nerve guys, 3rd branch of 5th nerve. And in the middle aspect of the tympanic membrane is supplied by the Jacobson's nerve, or part of a glossopharyngeal nerve guys. Thank you for watching the video.